Dr. Cochran is one of the physicians that all physicians try to emulate themselves after. He's totally devoted to his practice, totally devoted to his patients, gives them constant attention. It's just untiring in his devotion to his practice and his patients.
Of course, the mission of the hospital is to take care of any and all patients that come to our facility, and Dr. Cochran is the epitome of taking care of all patients that come.
If there's a patient that he feels like needs assistance in any kind of way and there's no other way to get that assistance, Dr. Cochran has a big heart and he's really willing to step out there and help in any way he can.
He probably goes above and beyond the means as much as any physician that I've ever been around in training or in practice.
We have in our community a lot of people that are below the poverty line, and when they come to him because maybe other doctors won't see them or they don't have a doctor and they're sick, and he'll take them on as a patient. Well, if they can't afford their medications, he has been known to pay for them at certain pharmacies around town.
He's got an elderly patient that's not able to come into the office. He will make house calls. I mean, that's just part of Dr. Cochran. He just, he's there for the patient and the families.
Sydney will admit people to the ICU and stay up with them all night, and the next morning, as tired as he is thrilled to death that he helped them diagnose their problem and treated them, and he still gets pleasure out of that.
And anytime that a patient comes in that doesn't have a physician or needs someone to take care of their needs, Dr. Cochran's always been more than willing to see that patient.
Usually if Dr. Cochran comes around the corner, you can hear him whistling, and the patients look for that every morning. And if he walks into a room and maybe he's missed a couple of rooms and that patient didn't hear that whistle, when he walks in, they'll ask him, okay, what's wrong with you? I didn't hear the whistle. So then he'll whistle for him on his way out. A lot of times Dr. Cochran may have patients that's coming into his office for their regular visits, and he feels like they need some tests done, or there may be something a little bit more going on that the patient was aware of. And you'll find Dr. Cochran putting that patient in a wheelchair and rolling them across the street to the ER for them to be seen.
He puts everybody else before himself, and that includes his family. He puts his community, his church, his co-workers, and especially the hospital here. He really does.
First of all, the people at our hospital who have put my name in for nomination for this award, I never suspected it, have been caught quite by surprise, but I appreciate their efforts on my behalf. And in accepting this award, I'd be amiss if I didn't recognize a few other people. First of all, I thank the Lord for giving me the talent to do this and the tools in which to practice medicine and put me in a place like Bainbridge where I've been very happy and have really enjoyed my career there. Secondly, I thank my wife, who's put up with a lot over the years. She had to do a lot of child raising by herself when I couldn't be there. She had to put up with me leaving or not being where I was supposed to on time. It's a wonderful blessing to be able to do this and be in a community where you're appreciated and supported, and also get the support of our hospital and medical community.